For a patient who undergoes a successful stem cell mobilization procedure, enough cells are collected to perform at least 10 immune restoration treatments at Okeanos. The potential side effects that we could observe during Regenevi's treatment occurs during the mobilization and collection phase, and this is mainly due to the drug that is provided, which has potential side effects of inducing flu-like symptoms and potential bone pain. Donors for Regenevi's immune restoration program are anonymous to us. They are recruited by the cell collection facilities through their donor networks. Donors who are interested will contact the collection center, where they will undergo a health evaluation to show that they are healthy enough to receive the mobilizing drug. Once they pass that test, they receive 5 days of the mobilizing agent and are collected on the 6th day, much like our patients. The ideal donor candidate is 18 to 29 years old, has a select BMI range, has healthy lifestyle habits including 5 days a week of moderate to light exercise, good eating habits and sleep habits. They should also be a non-smoker. We also exclude any young donor who has a prior history of cancer or is positive for HIV or hepatitis B or C.